Good afternoon, everybody. Thank you for joining us for this webinar that we're hosting. Energize Colorado is hosting in conjunction with WorkBright and some excellent panelists today. We're going to be talking about vaccine implications for employers here in Colorado. A little context about Energize Colorado before we get started. We are a nonprofit here to serve small businesses. Initially, we were built to help businesses recover and rise out of the COVID-19 pandemic. Now we've developed a new suite of programming to use this as a real catalyst point to drive some of the greater change that we want to see in our economy related to protecting small businesses and helping innovate and get online. With that being said, I'm going to go ahead and drop some links in the chat so that you guys can stay up to date on everything that we're doing. Our website will send you to a newsletter sign in if you want to sign up there, and then our social media accounts as well. With that being said, I'll pass it over to Dave Secunda from WorkBright to introduce our panelists for the day and go more in depth with our topic. And if you've got any questions, please submit them in the Q&A. Thanks.
Thank you, Scott. Appreciate it there. So I'm with you today because I'm wearing a couple different hats. First of all, and Scott, if you could go on to that next slide there. I am a volunteer with Energize Colorado and have been leading up, first of all, the contingent workforce sector, and now the initiative that is looking at affordable and accessible childcare in the state here. I'm also the founder and CEO of WorkBright. WorkBright, as many of you know, is a solution for electronic onboarding of employees. And so this particular topic is really a great merging between both of these fields. All right, work professionally, most of my time is about hiring people and all the systems to make sure that they are compliant and ready to go. And pandemic has, as we all know, created incredible challenges and friction points for those of you who own businesses, run businesses, or are HR professionals. So I'm very hopeful that today we'll be able to bring you some incredible content. And I'm really happy that both WorkBright and Energize Colorado have come together to talk to literally the hundreds of you who have elevated this topic to a high level there. So if you go on to the next slide, I do want to go ahead and introduce our panelists. And if you'd all go ahead and turn your cameras on, it would be great. I am so grateful for the caliber of panelists that we have with us today and their depth of expertise. I feel like we're going to have an incredible amount of talent here in order to answer the questions that you have. And before I go into a few of the details there, as Scott indicated, there is a Q&A box down in the lower part of your screen there. Please put your questions in at any point as we go through this process. We are going to hit those partially through the hour, probably about 30 to 40 minutes past the hour. So we will try and get as many of those questions answered as possible. So do feel free once again to ask as detailed or as general question you want, and we will try and get to those after we flow through some of the general information for you. So the first person I'd like to introduce is Nicole. And Nicole is a principal consultant with Colorado-based consulting firm Cura HR. She brings with her over 15 years of HR experience from her local, national, and global clients. Welcome, Nicole. I'm so happy to have you.
Thanks for having me.
Absolutely. And I know Cura quite well, worked with a number of the principal consultants there, and just a great depth of expertise and a great Colorado firm. Secondly, I want to introduce Raquel, who is a partner in labor and employment at Holland & Hart, one of the largest firms, not only in Colorado, but beyond. She brings with her, and I highlight this from her bio, over 20 years of experience serving as outside general counsel to Cafe Rio, where she helped startups effectively manage the challenges and opportunities facing nascent businesses, particularly in the food and beverage industry. That is one of the things I've pulled out across your broad spectrum of background there. But I bring that to mind because a lot of the folks on the call, as far as the participants, are those that are kind of managing contingent workforces, those that have part-time, temporary contract, and seasonal workers. And so I know you have a breadth of expertise. So welcome. So pleased to have you with us as well.
Thanks. I am excited to be with this esteemed panel today.
Fantastic. And finally, Eric. Eric is the CEO of COVID Check Colorado, which, boy, I bet has come up quickly and been a huge handful to manage over these last number of months. He served as a consultant on multi-million-dollar projects in both the private and for-profit, in the private, for-profit, and nonprofit sectors. He's built and led teams that have achieved historic results in fundraising and grassroots action in the 2018 governor's race and the 2020 U.S. Senate race in Colorado. Eric, I mentioned those parts. They stood out to me in your background because it seems like a job that is going to draw on all of your expertise on quickly spinning up infrastructure. Welcome, Eric. I'm so happy to have you with us as well.
Delighted to be here, Dave. Thanks so much for inviting me, and really looking forward to learning from the other panelists and hopefully shedding some light for all the wonderful folks who are here.
Awesome. Well, I'm going to actually start with you to shed some light to begin with. But just, if you can, give us an update on the priorities for distribution of vaccine and the manner in which such decisions will be made, and just kind of the overall picture of distribution and how it's going today.
Yeah, glad to do that, Dave, and thanks for the prompt. I'll start by saying that you all are probably feeling this acutely yourselves as leaders of small businesses and taking care of your own community of staff and clients and customers. That this is a moment of a lot of ambiguity and rapid change in policy, both at the federal and state levels, and in the descriptions and narrative surrounding that policy. So I just want to name that fact, which can be really frustrating and stressful for all of us. Dave, to more directly answer your question, though, at the moment in Colorado, we are what's called above the dotted line in phase 1B. Phase 1B is the second part of the first priority phase of patient populations. And above 1B is primarily older adults over the age of 70. Below 1B is a much larger category of workers and employees that include, for example, folks in the education sector, K-12 and early childhood. And so at the moment, the state is saying we need to take care of almost everyone above the dotted line in 1B before we move to allocating doses through providers to folks who are below that dotted line. So that's sort of where we are in that flow chart you may have seen from CDPH in the state of each of the phases. In terms of how it's going, it has been a decidedly rocky rollout so far. And the big challenge has really been, despite everyone's best efforts, closing that last mile. So Colorado is actually ahead of the pack of most other states in the country in terms of the percentage of doses in the state that have actually made it into the arms of patients. And yet, having said that, we're still hovering around 40-50% of doses in the state actually having been administered. So our ambition at COVID Check is to dramatically increase that percentage so that we are getting the herd immunity faster than any other state in the country. That is a big challenge, though, because a lot of pieces need to snap in place in terms of policy, finances, and operations so that doses, as soon as they hit the four corners of Colorado, can very quickly thereafter be getting to whoever the priority population is at the moment.
Got it. Thank you for that. Just a quick follow-on, because I know we also have participants from other states, and I suspect that rollout is similar. Sounds like Colorado is ahead. As far as this line between, we're above the line on 1B, is that similar to other states as far as where the priority is right now on who's getting the vaccine?
Yes, I would say a nuance there is some states have decided to shift to a lower age threshold for that 1B above the line population. So some states are saying now, if you are 65 and above, you are currently phase eligible or phase appropriate, and you can access a dose. Colorado, for the moment, is maintaining the 70 and above. And the reason for an age threshold at all is simply that folks above those age thresholds are at dramatically higher risk of severe illness and death from COVID-19. I'm 35, and someone in that 80 and above cohort is literally 400 times more likely than I am, if we're to get infected, to pass away from COVID. So that's the rationale behind those age thresholds. Different states are making the sort of threshold level, they're situating it at different points, but that's that's a nuance you might see across state lines if you're not from Colorado.
Yeah, I appreciate that. This one, you know, I got to say, it does really hit close to home to me. My father, who's here in Colorado, in a skilled nursing facility, contracted COVID at the end of the year. He has survived that. It has unfortunately precipitated a transition to hospice. But I think for all of us, we're at a phase where it's uncommon that we don't have a personal relationship involved with COVID in one way or another. Let me transfer to you, Mikkel. I know when I asked you this question before we were all getting on the air here, you said, well, you want me to talk for a minute or 60 minutes on this particular one, but just the lead-in question from your background is, at a high level, can you review the legal issues that need to be considered regarding employees and the vaccine? So this is just the first opener over the bound. We will have specific questions as we go forward as well.
Yeah, thanks, Dave. And you are correct. Most of us at this point know someone who has been touched by COVID. I'm actually doing this from my home today because I have a daughter who tested positive. She's 12. So we are in quarantine. And I think that's just the way of the world right now. But you are also correct that I could speak on this for about an hour. And so I'm going to give a very high level. I'm going to focus on federal laws. And you'll want to, as a business owner, stay very in touch with CDC guidance, your local state health department guidance, which is shifting and changing all the time, not only because of the changes to the rollout of the vaccine, but also because of the continued changes with the pandemic and the virus itself. So always as a backdrop, keep in mind you want to stay in close contact with what's developing with the CDC and your local health departments, because that is going to be your most up-to-date source of information. But again, very 30,000 foot, the three big federal laws that will apply to whether or not to vaccinate. And an employer, by the way, at this point, we don't have a definitive yes, go forth employers and vaccinate, but we have as close to that as you can get. The EEOC, the Equal Employment Opportunity Commission, came out on December 16th with some really great guidance. So employers can, if they choose, adopt a policy of vaccination with some certain protocols and safeguards in place. So we look at, and why those arise is because the Americans with Disabilities Act, the ADA, Title VII, the Civil Rights Act, which prohibits discrimination against certain protected classes, and GINA, which is a little discussed law, the Genetic Information Non-Discrimination Act, all come into play. And the two big things that I see emerging from all of the dialogues for employers is, should an employer adopt a vaccination policy at all? And if they do, should it be a mandatory vaccination policy? Some are calling it like a pro-vaccine policy. I don't love that pro-vaccine language, but a mandatory vaccination, or a personal choice type policy where you're giving employees the choice whether or not to get vaccinated. If as an employer you decide that you want to adopt a policy, best practice would indicate that should be in writing. And then you need to decide whether or not you as an employer want to administer the vaccine or you want to use a third party. And I will tell you the best way to stay away from violation of things like the ADA, Title VII, and GINA is to have a third party administer the vaccine if you're going to require it, and then only ask that an employee bring you proof of vaccination and nothing more. Because what happens is if we start asking for more, requiring more, doing pre-screening testing, we start getting into the ADA. And if an employee is disclosing something that might give rise to a disability, if an employee is disclosing a closely held religious belief that may give rise to discrimination under Title VII, and if we're connecting or collecting information about, for example, the immunology of family members, then we can start running afoul of GINA. So if you're going to do that, and I know we'll get a lot of questions, what you want to do, again, 30,000 foot, is have a written policy that states what the employer's policy is going to be. And then you must include exceptions for employees who cannot vaccinate because of disabilities. And then you would have to engage in the interactive process to determine what, if any, reasonable accommodation can be made. To not require vaccination for those who hold sincerely held religious beliefs. That is different than a secular or medical belief that does not have to be accommodated. And then the other really important part of this is that your policy needs to state why this vaccination protocol is job related and why it is consistent with business necessity. That kind of takes you outside of the sphere of running afoul of the ADA. So those would be really broad brushstrokes, the 3 big laws you'd want to pay attention to if you decide to put a policy together.
Oh my gosh, so much to think about. I saw one of the questions here just saying there's a lot of information. Things are changing so quickly. There's not a set of handouts for this webinar. We are recording it. We will send it out to all participants so you can kind of go ahead and fast forward to those parts that you might want to listen to, but we'll try and get you a lot of information as we unfold here. Nicole, over to you, because kind of looking at the triad of folks here, you're really the one that is in the trenches. So you're, interacting on a daily basis with employers. You're trying to figure these things out and make these difficult decisions. The two-pronged question for you is can you talk about the benefits related issues with the vaccine, and also just in general, what are you hearing, what are you seeing from employers as the major issues that are coming up on your radar?
Yeah, this topic has been so evolving and everybody's been having to adapt. Literally, I mean, when this started, we were adapting within the day. Something we were saying in the morning might change by the time you're ready to log off for the end of the day. So being adaptable is really important. And as a part of that, what I have seen is a lot of a lean towards encouraging, but not mandating. And I think it ties to what Mikkel said in regards to job related and business necessity. If it's an office position and you're all working from home, it all depends on what you do and how you do it. And so when it comes to the business piece, the CARES Act did mandate employer-sponsored health insurance plans cover COVID-19 vaccinations at no cost. And the ACA, which Mikkel also brought up, requires that another piece of that is that preventative services are required at no cost with ACA. So when you think about vaccination, it's a preventative act. And the CARES Act did create special rules for COVID-19. I'm sure Eric knows a lot more about that, but and because of the timing and the rush to get this out, those are just things to be aware of. Another thing that comes up with benefits is HIPAA, right? So when you are asking for proof potentially of vaccination or not, what are you doing with that? Making sure that you're keeping that information separate and secure, or not disclosing any information. Mikkel brought up GINA as well. So that was another thing that I had in mind when it comes to what information are you getting and how are you tracking that? Sometimes it's, if you have that information, do you even need to keep it? And thinking about those things.
A related question just came through from Jerry, I think it was, which is, what about privacy policies in your workforce there, like informing coworkers who has been vaccinated, who has not, that sort of thing?
Yeah, I would not encourage sharing any information in regards. I mean, the difficult part, this comes up with pay all the time, right? People share what information, right? So, I've seen Facebook posts, I got my first shot today, those kinds of things. And I think that's where you just want to make sure you draw that line as the employer, that you are not sharing that information. That's not your information to share, and reduce that risk.
And Dave, if I could just add, this kind of information does fall into other types of health or medical related information that an employer might gather and needs to be kept separate from the overall general personnel file and treated as with the utmost of confidentiality.
Got it. Thank you. Mikkel, another question for you, just a follow on. You talked a little bit about that employers are being able to require the vaccine. Can you just say a little bit more though on the threshold of allowability there, meaning, you talked about the need to document why you're you're requiring the vaccine? Like, are there any hard and fast rules about that? That are saying, hey, if your customer population are vulnerable individuals, you can require it, but if they're college students, you can't, or is it, where does it go from there?
Yeah, unfortunately, there's no hard and fast guidance, but what you're saying is directly in line with what the EEOC has started to come out with. And Dave, I'm going to send you a link to the EEOC has compiled all of their COVID guidance and recommendations, so you can send that out to the members. So it's a really good place to kind of stay up to date on what they're recommending. But basically, employers can require vaccines before employees return to a work site if the failure to be vaccinated would constitute a direct threat to other employees in the workplace or customers, depending on if you're retail and whatnot, because the virus is maybe rampant or easily transmitted, right? So the more likely it is, and this is a good rule of thumb, the more likely it is that non-vaccinated employees, customers or fellow employees or the general public at risk, the more compelling the business case is for vaccination mandate. And business context matters, right? If you're in the healthcare industry, if your employees travel for work, if you're in the restaurant or the retail business, you have much greater business need for protecting employees and the customers.
Got it. Understood. We will record this and send it out. I just saw somebody's message there in the chat. Thank you for that perspective on it. It sounds like still a gray zone. Do your best, document it well as far as the background, as far as why you're making those choices.
And the other thing I would add is that even within that business necessity, you want to remain mindful that within the job positions, right? It has to be job related. So if part of your workforce can work remote or is in an office, that is different than the part of your workforce, say, that is dealing directly with retail customers. So keep that in mind as well.
Yeah, that's a great illustration. I run a company that runs summer camps, but I'm on the admin side of that. Obviously the field staff, maybe 1B, but me down with the rest of the population. So Eric, over to you with a question. Since we're talking about the potential to require or not require, where are things going as far as proof of vaccination? What is appropriate? Are there concerns about fraud? What are the issues that you're seeing on that side of things?
Yes, there are both analog and digital tools that are coming online to make this possible. So standard right now is that you actually get a little card. It's a little larger than wallet size that's been printed up by CDC, which indicates you've gotten your first dose. And then it's also supposed to serve as a reminder of when you get your second dose. And that's something you can carry around and show as evidence that you've been vaccinated. There are also in, I think, early stage, some like phone-based apps that basically serve as your vaccination passport. I say early stage because I don't think they're being used widely right now, and there's still open questions about how best to make use of those in a way that protects privacy and also, ensures authenticity. So if someone's showing you a screen that says they've been vaccinated, you actually know that's the case. This is one of those small but important details for making sure this actually goes smoothly, and we're all clear on where everyone stands in terms of workplace safety and protecting data at the same time. So it's a bit of an open question at this point, how best to manage that.
So it sounds like full analog at the get-go here, and if employers are requiring it, obviously and unfortunately, there may be a concern for fraud and just saying I have my certificate. But it sounds like what you're saying is for employer, make your best efforts to assess a document like you would any other document that an employee provides, and go with that. Is there any database the employer can check, or is it just here's that piece of paper?
So there is a state database of immunization information, but it's not one that, to my knowledge, and I would defer to counsel on the call here. It's not one, to my knowledge, that employers can query basically to get info on their own employees. That's all got to be information that the employee would share with the employer.
Got it. Okay, thank you for that. Nicole, back over to you with the question. If you are requiring your employees to be vaccinated, can you just talk about the various compensation, wage issues, comp time, treatment of monetary incentives, like just the big compensation question, like what do you have to do, and what's not only what do you have to do, but also what's the right thing to do?
Yeah, those are two different things sometimes, right? Yeah, under FLSA, employers must reimburse expenses that an employee incurs that is intended for the employer's convenience. You know, there is OSHA, right? And OSHA, the general rule with OSHA is you need to keep your workplace free from hazards. You know, and in some places in the past, right, we've seen a flu shot requirement, and that should be paid for. So when it comes to this, do I compensate them? If you're mandating it, yes. And should their time be paid? Yes. If you are not mandating it, then that's where you can consider potentially incentives. If you are encouraging vaccination and not mandating it, you would just want to ensure any incentives are not considered coercive. It can't be a huge, you know, it needs to be reasonable. And maybe Mikkel, you have more to add on that, but you would want to have that be part of maybe your broader strategy. Maybe it's paying for their, you know, maybe if you get the vaccine, you take give them 2 hours of pay for that. And whether or not, you know, so they're not worried about childcare or travel time, things like that.
Right,
yes.
Understood. Thank you for that. Great. So let me open up some questions to all of you who might know things about this. I've had these questions from businesses before. If they are mandating their employees to be vaccinated, can they advertise such? Can they put that forward? Or is there any guidance around something like that?
You mean advertising it within the employee population or advertising it to the community?
No, I mean, just for example, you know, hypothetical, you're walking into a facility, you know, can it have a sign on the front door that basically says we require all our employees to be vaccinated or something of that nature?
I haven't seen anything on that from a legal standpoint. I imagine that will emerge in much the same way that you see a lot of businesses now when you go and they have this sticker that says our facility has been, you know, deep cleaned on this date. We require masks of all of our employees and customers. So I imagine it'll emerge something like that, but I haven't seen anything like that. Maybe Nicole or Eric have.
I'll mention real quick, just internal communication sometime, you know, their company newsletter, maybe it's a statement from a leader or influencers, you know, key stakeholders within the organization saying, I got, you know, sharing that they think it's important and sharing that kind of message, but not into the broader communication to the public. I've seen it more internal.
Not adding it to the name tag like red, not vaccinated, green, vaccinated. Okay, we'll stay away from that one. Hey, Eric, just in general, talk about the cost factor of the vaccine. Who's paying for the vaccine right now? And as you see this full rollout, is there going to be a cost and how does that work?
Yeah, glad you asked. So some good news here is that basically the federal government has stepped in to purchase the doses and then cover the cost of distributing them out to states. And so what this means for individual patients is that they're not on the hook to pay for a dose. What providers can do is bill insurance carriers what's a modest administrative fee for administering each dose. It averages out to about $22 a dose. But that is the doses have to be administered whether a patient has insurance or not. So the short answer is this should not be a financial burden in any way. In fact, there should be no cost to the individual patient, and any costs being borne by insurance carriers should be relatively low.
Got it. Thank you for that. So question for all, we've had some questions around seasonal workers that have priority due to their job. So let's say they're going to be childcare workers, but not yet, you know, or let's say it was before the winter and they're like, I'm going to be working in the childcare unit at the ski area as soon as that ski area opens. So I'm going to be working at the summer camp when that summer camp opens, which would kind of raise their priority, but they're not yet doing that. How are those considered as far as prioritization, and how does an employer potentially interact with employees who are potentially have an offer letter, but it doesn't start for 2 months or 3 months?
That's a tough one. I think when it comes to the contingencies, it can get muddy. I think if you've offered a position, and maybe I didn't hear all of that question, Dave, but if you're offering a position and now you're saying there's a contingency on it, I think you would want to reissue that offer letter and clarify that with them if it's being mandated.
I think also it's the question of, right now, these, well, let's go with that example, ski area or summer camp workers, they're young, they don't have any priority other than there will be in childcare services at a latter point in time. So it might be a question over for you, Eric, as well, like how are those prioritizations set, 1A, 1B, 2, is there any, like how do employers navigate that with seasonal workforces that might not be working right then that would give them priority?
Sorry, Dave, just make sure I'm clear. You're asking about basically how we get contract employees into the phase appropriate or register them for vaccines?
Into the phase appropriate, yeah. So a lot of employees right now are getting the vaccine because of their work. There are especially in Colorado, a huge seasonal workforce. We have employees that are going to be coming into work that would give them a different phase of priority than they would have without that. But just wondering, like, how does that happen, or is there a mechanism for that?
Yeah, so the answer here is unfortunately this is a little bit of an anarchic situation right now. It's pretty disorganized, to be quite candid, and the state is trying to make moves now to create some sort of or have providers who can access the doses and then administer them, create some sort of registry and appointment system where they're gating on the front end who is phase appropriate. Those systems are very much under construction. They don't really exist widely yet. And so I wouldn't be surprised if many of you have heard stories about a given teacher or a given daycare worker who's already gotten vaccinated or a whole school's worth. And those situations are real. That's happening. It doesn't mean we've shifted from 1A to 1B. It means providers are scrambling in some cases where they've thawed a bunch of doses and they don't want them to go to waste. They're putting in a call and just trying to get people in to use them. That, of course, gives the impression, which is real, that there's a lot there's a wide variety in how this is being rolled out. So the short answer, though, is by the time we're in phase 2, there should be way more doses available, and that should enable providers to make this a more regular and orderly process where it'll be a lot more like scheduling a test through COVID Check now, where you go on a website, you click get my vaccine, you schedule an appointment, and you can go in. One other dimension of this is even in the current phases, a lot of providers are effectively relying on an honor system. The state's actually made it clear you can't ask for ID because they want to make sure that folks who are undocumented are not being discouraged from getting the vaccine. And so what that means is basically, if you're saying you're part of that group and you show up and the provider's giving you an appointment, you'll get your dose.
Yeah, I've heard some news reports on that as well. So back on the integrity system, I'm going to try and knock out some of the dozens of questions we have from participants. There is a little Q&A down in the bottom there. So I'll ask our speakers to see if we can keep answers brief and focused on these, and we'll try and kind of move through them. A number of them here. This one might be one for you, Eric, as well. Due to the amount of categories in phase 1B, any insight on how those will be prioritized? Is there anything we can do to affect our priority?
At this point, there's not too much that can be done to change the priority. It's unclear at this point if the state's going to try to create a hierarchy within those subcategories, or if it's simply to say, once we're below the dotted line, if you fit into any one of these groups, you're good to go. My current understanding is that the latter thing I said, that basically once we're below the dotted line, any one of those other subcategories of 1B will then be eligible. I think that's the situation we're going to be in. The big gating factor right now is just access to doses. So we have doses in the state that haven't been used, but there are not yet enough to cover everyone who might be eligible under the dotted line part of 1B. And so the state's saying, let's hold these current doses in state to get them out to our 70+ population first. There's not really a clear pathway yet to say, if you're a teacher versus a restaurant worker or pick your other category, that you can help your folks, get in ahead.
Got it. Okay. There's a number of questions on this. So I'll just try and kind of move through those. But Mikkel, and you had mentioned the potential of a employer hiring in-house somebody to provide vaccines, or providing the vaccines themselves. Can anyone speak to that? Is that happening outside of the healthcare community right now, or is that only within that community? And this question is from a manufacturer. Is there a site where we can go to sign up when we get to phase 2 to have someone come in-house and do vaccinations in-house?
So I'm not aware of outside of the healthcare industry, many employers doing this right now. What I would say is if you're an employer that is considering administering the vaccine in-house, you want to think very carefully about how you're going to go about that, because the pre-screening process is where a lot of these disability disclosure issues come up that then trigger the interactive process under the ADA. And it can sometimes, despite, trying not to gather the information, the employer receiving genetic information as well. And so the employer needs to be really careful if they decide to do that about who's managing and handling that information. You don't want people who make employment decisions handling that information and having it, despite their best efforts, influence a decision. I would say a best practice would be either to just create a process where an employee can go get the vaccine and just bring the card, perhaps one that Eric was talking about, that shows that they've received their vaccine. And if you're going to bring a third party in, to really limit it so that you are not receiving anything from the third party other than verification that the vaccine was administered.
Got it. Thank you for that. There's a number of questions from childcare providers. I'm going to try and knock some of those out. This one might be one for you, Nicole. I'm an admin at a childcare facility. This one's from Pam. Since we work directly with children and families on a daily basis, we're not allowed to tell families if any of our staff chooses to get vaccinated. Can we tell families if we receive permission from the staff?
I mean, I think sharing that you encourage it is what you can share. I mean, again, I go to the conservative side of not sharing any personal health information. I mean, I think that's that teacher's choice if they want to share that with the parents, but it's not the employer's responsibility, nor should I recommend that they do that.
Got it. Understood. Our licensing body requires that our staff are up to date on all immunizations. Would the corona vaccine be included in this?
So I haven't, from a legal standpoint, I can say I haven't seen a determination by, say, the FDA or any other regulatory body that would include that. That may be something that comes down the pipeline from the government in the future, but this is still such a new process. I think that has not yet made its way to the top of the list.
Got it. Got it. A question on legal ramifications if you require the vaccine, but then the person gets a severe reaction or death. Any insights on that as far as employer liability?
So again, I think this would be another reason to go in the pro column for why an employer would want to send employees out to a licensed healthcare provider or bring in a licensed healthcare provider to administer the vaccine if you choose to go that route. Some states adopted early on some limited immunity from liability statutes, but those were related to coronavirus and COVID-19, but those were mostly related to protecting employers from being sued if an employee contracted coronavirus or a customer contracted coronavirus while on the premises. So we may see some amendments to that legislation or some new legislation to address this as well. But there's nothing that I've seen on a federal or state level that's looked at that specifically.
Got it. Sounds like the Wild West, figuring it all out, pretty darn quickly here. I think we'll have a lot more answers 60 days from now if we reconvene on this one. Another one around a business that provides professional coaching, and which does not necessarily require the vaccine for their employees. See to do that, but some of their customers who are childcare centers require anyone who is working in that center to be vaccinated, and so the employee can no longer perform their job as described. They're just wondering, what can I do or not do regarding that sort of a situation?
Mikkel, maybe you have some on this too, but if that's the business necessity, that's where that can fall into play. If it's required for you to go on site to these childcare facilities, then that would determine the business necessity. I think the other thing that we haven't yet talked about potentially is the whole accommodation process. I think it got touched on briefly, but just because something is mandated doesn't necessarily mean that everyone is going to say, yes, I'm going to get vaccinated. So ensuring that there is an accommodation process in place. And I think sometimes that's where I see that lacking, is with smaller employers, and they're not maybe subject to FMLA and they don't know all these requirements. So just ensuring that you are going through some general steps of what accommodation are you requesting. And this could be in place for anything, right? So I work from home, I need a different type of chair. I mean, it's not just, I don't want to get the vaccine because it's not something I believe in, or I have a disability that prevents me from getting it. So, Mikkel, do you have more on that?
Yeah, I know. I think that's right. That's spot on, Nicole. So a couple things to keep in mind. The federal laws, the ADA, Title VII, and GINA apply to employers with 15 or more employees. However, state laws, many states, including Colorado and I think some local cities within Colorado, have expanded. So, for example, anti-discrimination laws apply if you have one or more employees, right? So you want to be really careful about looking at what your state requirement or your local requirement is, because the compliance obligations may kick in even just with one employee. But it is also correct that this accommodation process is important. So in that specific scenario, I would recommend that you have a conversation with that childcare facility to understand what their business necessity is and what the job-related requirement is for that particular job. So you can understand that and have a dialogue with your employee. And then you need to talk to your employee about, if they're not okay with getting the vaccine, why? Is it because of a disability? Is it because of a closely held religious belief? And if you have one of those scenarios that would trigger the interactive process and trigger evaluating that, then maybe try and partner with that daycare facility to see if there's a way to accommodate that individual who doesn't want to get a vaccine.
In the same way that they might accommodate their own direct employee in that situation.
Yes, and a lot of this comes out of the flu shot vaccine, the flu vaccine.
Yeah.
It's the same thing. Some people will say, I don't get the flu vaccine because I have a closely held religious belief, or I have a certain immunosuppressed, other issue within my body. And so that is a pretty well-developed body of the law, that if somebody has a legitimate reason why they can't get the vaccine, you need to take that into serious consideration.
Got it. Bunch of questions from the hospitality industry and kind of how that is relating in the prioritization. Emily was saying, hey, in general, my workers are young and healthy, but they're also working in a lodge in close proximity with customers. What phase do we fall into, and are there exceptions to the phases in regards to the hospitality industry? How does that work?
I'll jump in on that one. I'm not sure of it. Thanks, Dave. Yeah, I'm not sure about exceptions for the hospitality, and apologies, everyone. I know every time I'm chiming in here, I'm saying I don't know, and it's confusing. That's just me being honest with you. I'm sorry. But yeah, as far as I know, there are not currently special exemptions or exceptions for hospitality workers. So that's the state of play as I see it.
Got it. As an employer, this is related to a few of the questions here. If I am requiring vaccination, but my employees are coming from out of state, can I get them vaccinated in their state, or have to wait till they come here, or is there any like cross-state issues that we should know about?
So I don't know that I completely understood the question.
Well, I think that what I heard from Eric in the beginning is states are really rolling out at different rates and different paces with different ages and kind of a general alignment between who gets vaccinations first and last, but not an exact alignment. So if an employer is hiring somebody from out of state to come work in their state, is there any kind of reciprocity where, you know, or how is it? I guess what I heard you saying, Eric, just in general, is it's on the honor system. I'm guessing that's in any state right now, so that if they walked in and were, you know, coming from North Dakota to Colorado, they went into North Dakota and said, you know, I'm a healthcare worker or childcare worker moving to Colorado, that it would just be on that basis. Is that correct?
I don't know anything about that at this point because it's all still so new, but Eric, that may be something that you're dialed into.
Yeah, it's unclear for me too, unfortunately. Yeah, this is I mean, this falls into the category of a forecast or prediction, which is just based on thin evidence that you all can probably pick up from reading the headlines as much as I can. But I think what we're about to see is a few shifts in both federal and state policy and funding that are going to try to make this more standardized across the country. That could take a few different forms. One could be that there's a national registry. So the government, federal government puts money behind software that enables anyone in the country to basically say, I'm phase eligible and I want to book the next appointment. They could disseminate money to the states to stand up similar systems, or it could remain closer to where it is now, where basically every provider who has access to doses is trying to build their own way of enabling people to access them. There are benefits and drawbacks to each of those approaches. Right now, we're in the last one I named, which is a little bit of what Dave said, which is kind of the Wild West, where it's a little bit of every mom and pop clinic and every major healthcare system for themselves.
Figuring it out. Yeah.
Yep. Yeah.
Right here. Yeah. This is an interesting question. Can facilities require customers to be vaccinated to be served, like masks? You know, boy,
I was just looking at I'm trying to look at the Q&A in between and answer some if I can. And I saw those. I sent an answer to the question right below, which was similar. I have not seen any legal guidance on this in particular. I imagine, and I think it's because it's so new, I imagine that is going to be one of the developing policies that we're going to see, because I think it is going to come up, much like the mask requirement. Where a lot of businesses, even if there is not a local public health order in place that requires a mask, are opting to say you may not come in without a mask. Then there's the enforcement issue, because I will tell you that I have many employer clients that even though they may have adopted a mask requirement in a location where it's not required by law, there are still going to be people who will purposefully and defiantly even come in without a mask just to see, you know, what kind of a conversation they might stir up. And it's very difficult for employers because you don't want to put your employees in a situation where things can get out of hand pretty quickly, right? So I think we will see something develop out of this, but I personally have not seen any guidance on it yet. Got it.
Thank you. And maybe a good question for you, Nicole, on this one. Can you talk a little bit more about accommodation for not getting the vaccine? And just like the questions on here are interesting. You know, if it's best to receive the vaccine to keep the children and other staff members safe from a deadly virus, you know, how is this weighed on personal, like as an employer, do you have any grounds to stand on, or do you just, if there's a request for accommodation, are you just like, I got it, just because someone requests an accommodation doesn't necessarily mean you have to accommodate it, right? So I mean, I think there are things that you have to think about when it comes to what do we do? What is this job? You know, I had someone who didn't want to come back to work, who was in childcare. They ended up leaving the
the industry. They are not in childcare anymore. I think people are really looking within themselves to just say, is this the kind of job I want to do? I work in the public, or, the interactions that I have may put me at risk. And I think those are bigger, broader questions that aren't necessarily for the employer, but I do think that it's something that's making employees question themselves a little bit. It's an unprecedented public health emergency, right? This is all new for all of us. And I think it's asking some of those questions and figuring that out as an employer. What are we willing and able to require of our employees, and what is really appropriate? And it's not, you have to take that legal side and balance it kind of just with the people part. At the end of the day, we're all people, and what might be right for me might not be right for someone else. And you just got to take that empathetic and compassionate point of view with it as well.
Got it. Thank you for that. A number of questions related to just how do you get the vaccine in general. There's one here from Steven, says, I run a chiropractic office, houses physical therapy and massage therapists. All local PT offices associated with the local hospital system have been vaccinated, but we're private, thus we have not. Is there a way to request that my staff get vaccinated sooner than when it's our turn? Or how is it that you get those questions answered? Like, I think I'm in the zone to get my staff vaccinated. What do I do? I'm a small business. I'm not associated with a large hospital system. What is the process for an employer or for an individual? And does it fall to the employer to figure it out? Or if you tell an individual, yes, you're required to get vaccinated to work here, what is it right now, today? What is their process or an employer's process to figure out, like, okay, I think we're in the zone of vaccination right now. How do we do it? Eric, you might have insight on this one.
Yeah, this is this is going to feel like a common theme here, but this is another area where it's very TBD. The state has recently pushed providers to create a system for that's online that can enable folks to register for vaccination and schedule an appointment. That guidance and requirement went out either last Friday or this Monday and was supposed to be complete by this Friday. For any of you who work in tech or software, building a brand new product that's supposed to be flawless and available to all customers in 4 days is a pretty it's a pretty heavy, verging on unreasonable ask. But providers, to my knowledge, are faithfully trying to execute there. Those are going to get stood up, I think, in the days ahead, and that will be the main pathways through if you're a patient with an existing healthcare provider or hospital system, that provider, if they're getting doses, should have some way for you to register yourself, even if it's in advance of the phase that is currently open. So for my friends who are teachers, they should be able to, and they're a UC Health patient, they should be able to go to UC Health and register, even if UC Health can't book them an appointment next week because we're still above the dotted line at 1B. I think that's the default pattern that's supposed to be in place moving forward. Again, that could shift in a dramatic way if the state or the federal government decide to either impose or create a different system that would replace that one.
Got it. Thank you for that. Mikkel and Nicole, this one might be for you. Volunteers, can you require them to be vaccinated? Or what's the next ring of requirements? Could you asking parents of students to be vaccinated? Can the requirement be beyond just those folks who are employed, contractors, all of those sorts of questions there?
Nicole, do you want to go first?
I'll let you go first.
So there are all kinds of other legal issues that can come up with volunteers. So it's a little bit trickier, but if the company as a whole has decided, for example, we are a long-term elderly care facility, right? That's kind of the easiest call. So as a business necessity, given all the statistics and the vulnerability of our population, you are required, if you are going to provide services here, to have a vaccine. And then you again want to look at the specific job positions, because if you have an independent contractor that comes in maybe just to service the photocopier in the back business office and doesn't interact with your client population, that may be a little bit different than, let's say you use like the locums nurses or something that come in on a temporary basis to provide care. That's different because they're interacting with the business population. So you want to again go back to what's our overall business necessity and what's our specific job related business reason.
Got it.
Yeah, and just to
it.
add on to that, I think when it comes to the volunteer piece, if I have a volunteer coming into our workplace and supporting clients or patients or whoever you engage with, the community perhaps, it's, just like you would require an employee to not discriminate or harass, you're going to ask those volunteers to do that same thing. So it's similar to that, you're not an employee. I'm not going to make you sign our policies to make sure that I can hold you accountable to that. But likely there's some sort of volunteer agreement when it comes to, hey, as a volunteer, I understand and respect X, Y, and Z. And if it comes to the necessity piece, then potentially requiring it. So.
Awesome. Well, Nicole, Mikkel, Eric, thank you so much. That was an action-packed, just about 60 minutes there. I know there were a number of questions we're not able to get to. I apologize for that. Open topic. We'll try and get more info out in the future on this. This has been recorded, and thank you, Scott, for kind of sending it out to all participants after the call so you can refer back to it. I'm deeply grateful for everyone's time and expertise on the phone call today, on the webinar, and for everyone's attention and time in logging in today. Everyone stay safe, stay healthy out there. Take care.
Thanks very much.
Thanks, everyone.